Senator Sifuna, do you have any supplementary question?
Indeed, Speaker, I do. Unfortunately for me, the ODM expert on PWDs is not in the House today, Senator Crystal Asige. But I do, if my memory serves right, we did pass as a House an amendment, Honorable Speaker, and I thought we touched on this question of taxation of assistive devices. It just doesn't make any sense why a government would impose VAT on essential components such as hearing aids. But I want to assure the Minister that we'll be following up when that tax conversation comes up to see that this government actually does away with taxation on those essential hearing aids. But since the CS has pegged down the capping of receipt of these assistive devices to 18 years to the cost of the product, and if you look at the response, it's saying that it is a cost containment measure driven by current resource constraints. Does the CS or the ministry have empirical numbers? How many people above the age of 18 in the country, or what percentage of the population is actually in need of these things, so that we actually know that it is a heavy cost to government and you're not just telling us stories? Because you've told us here you are undertaking actuarial assessments, which I believe must be based on data and numbers. Do you have those numbers, Waziri, on how many people above the age of 18 in Kenya require these assistive devices? I thank you, Honorable Speaker.
Senator Duale.
Thank you, Mr. Speaker. A quick one. Waziri, I have a patient who has a heart problem and currently admitted at Tenwek Hospital, Bomet. Now, what I'm getting is that SHA is paying 537,000.
Now, Senator Duale, you know the subject of the
my question,
the
Mr.
subject
Speaker.
of the primary question.
Mr.
You know
Speaker,
it.
I'm building my case. It's
Okay.
on SHA. I'm just inquiring.
Yeah, but the question at hand, the primary question is
Mr.
actually on the devices.
Mr. Speaker, I raised my request earlier on when actually Senator Hamida was on the floor. And
So
even
it's not
before.
related to this question.
No, it's on SHA, Mr. Speaker.
I will allow you.
Thank you. So, Waziri, this patient is in the hospital and the bill is about 1.1. SHA is paying 530 something. The patient is supposed to pay the balance. Mostly on heart problems, people actually seek where they can be able to get quick response to their issues. I'm told there are criteria, or rather there are categories of payment for different hospitals and different diseases. So I really want to know more specifically on that particular patient or heart. I have about 4 patients from Isiolo who are having similar challenges, actually going around to raise funds to meet the cost of the operation. So do you have categories of hospitals and diseases that you pay different charges, especially those patients who are covered under SHA? I thank you, Mr. Speaker.
Senator Haji.
Thank you very much, Mr. Speaker, sir. Mr. Speaker, sir, before I go straight to the question, I just want to state that as the Senator of Garissa, I am very happy and proud when I hear senators like Cherargei and Cheriot and Senator Sifuna praise the CS of Health, who happens to hail from Garissa. Senator Sifuna, you did say that he answered your question. No, you said he answered your question, and you're very happy with his answer. So, as a Senator of Garissa, we're very happy and we're very proud of our son who hails from Garissa and he's got a very busy ministry and is doing a good job, and we want to wish him all the best. Mr. Speaker, sir, since regional cancer centers were established, they've been supported by the Ministry of Health through the supply of essential oncology drugs, which covered over 24 treatment regimens, including those for breast and prostate cancer. Over the past 1 year, we've seen a significant reduction in the supply of these oncology drugs, I would like to ask the CS to clarify whether if there has been any policy shift regarding the provision of cancer treatment drugs from the national government to the regional cancer centers, and how such changes affect facilities in marginalized regions such as Garissa County. Thank you, Mr. Speaker.
Senator Eddie Okech.
Thank you, Mr. Speaker. On the question by Senator Muma, Mr. Speaker, I didn't find it satisfactory. I've read the response here. Waziri, the question was, Mr. Speaker, when will the discriminatory age restriction be removed so as to allow adults with hearing impairments to access hearing aids under the SHE assistive device benefit package? Mr. Speaker, if you look at the response, I have no sense of idea of what timeline has been given by the CS. And with regards to that timeline, we need just to be very clear to be able to actually track that timeline, so that as Parliament we can actually be able to hold the ministry account to a timeline. So could the minister give us a timeline, not the narrative that is here?
Honorable CS, you may respond.
Honorable Speaker, let me start with the last question. If Honorable Senator Eddie Okech read my statement, it's not a narrative. It's giving very clear direction. And I think Honorable Senator for Nairobi question is, because I have said we are looking at the whole issue. There's an element of taxation which we want to sort it out in this finance bill of this year. There is an element of we don't have specialists, but the element of the benefit package, which you have, I'm sure you are interested in when, is that we are looking at the current package, and that is under the Package and Tariff Advisory Committee, which we have submitted. It's an independent body that looks at many, including the one of cancer from 550 to 800. So, Senator, we will give you timeline. Once if tomorrow or the day after or next month the tariff package based at the University of Nairobi, if they give us, and they do public participation, they talk to the patient, they talk to stakeholders. Honorable Senator for Nairobi, I did not, the global percentage is about between 6 and 7%. And I suspect the same for Kenya. So 6% of the Kenyan population fall within this category, and I will give more detailed once I go back to the office and get the division. But I think it's about 6%. 6% comes to over 60 million, for example, if we say it's about 10 million Kenyans who are close to it, who are under this. Senator Dulo, yes, all our benefits for all is on the website of SHA, and all hospitals, both private, public, and faith-based, they use that, and it differs even within surgery. And I'm very happy to thank you for taking that patient to Tenwek. Tenwek is a place I have never been there. I mean, I used to hear, I went there, and in a day they do close to about, I think, 10 to 15 cardiovascular surgery, open heart surgery. Some of the best doctor surgeons are there, and I really want to ask even the House that it might be very far, and it might be in rural Kenya, but that facility, if you are in Bomet or that area, please visit. So I will, if you give me the name of that patient, I will look at it. But that patient is right, and I'm sure SHA does not pay everything. Maybe on that particular benefit, it's 500,000. But if you send me the name of the patient, I can ask the leadership of SHA if there's something that we can do. But Senator Sifuna, also 2.2% of Kenyans also have the same form of disability. Approximately 1 million persons, according to the last population census. Senator, Abdul, but before I come to Senator Abdul, my sister, Senator for Isiolo, maybe we'll also look at the surgical package of that patient. Because there are different surgical packages that the tariff is the same, and it's the same for all hospitals, both private, public, and faith-based. Kenyatta the same, will charge what Tenwek will charge, what Nairobi Hospital will charge, what Aga Khan will charge. My senator, thank you very much. At least I have not let you down. I am also proud of my senator. But yes, the Regional Cancer Center, at least in Garissa, with the help of the governor, and the same for, we are now doing with the governor for Nakuru, for the Regional Cancer Center, and the one in Mombasa. And Honorable Speaker, we are also building a cancer center in Meru for that region, and also in Nyeri, so that we have a lot of cancer. But the one in Garissa, number one, what we have done is we isolated it from the main hospital, and now it has its own SHA account. Before it was put together with the county referral hospital. So we've agreed with the governor and the leadership, now it's on its own account. So all the patients, and it serves about 10 counties, from Isiolo, Marsabit, Mandera, Wajir, Tana River, Lamu, Kitui. So it's a very busy place. I will even maybe, Senator, you need to help me that we need to, there was some hostels, wards, which were started. We need to finish the wards because the patients who come from far, they have a problem of accommodation, and it's a bit expensive for them. So what we agreed with these 3 regional centers, including Garissa, is that they buy the consumables, and then the Ministry of Health will take care of the servicing of the equipment. Because the biggest problem was the infrastructure. The machines were broken down very often as the patients are on the line. It happened in Kenyatta, now we have rectified. So Garissa Regional Cancer Center, Nakuru Regional Cancer Center, and Mombasa Regional Cancer Center, the Ministry of Health, using the tobacco fund, which is related to the upsurge of cancer as part of it, we are now paying for the service level agreement so that the machines are serviced, and it's a very expensive exercise. It's costing us close to about 200 million for those 3 counties. So I think I will talk to the people in Garissa and ask them why they are not buying the consumables. I think they should buy it's on their part. Maybe you'll help me talk to the governor. And these 3 centers, Honorable Speaker, I think just to give as I said, 44,000 Kenyans are infected, cancer is affecting them in a year. So we have made a deliberate move that we build another 4 cancer centers, one in Kisii, one in Nyeri, one in Meru, and one in Kisumu. And I really want to seek the support of the House to help me sensitize screening for cancer. We need to talk to our people. Early detection, early screening is very important. Most of them are detected when they are at a very advanced level. And many cancers can be treated if they are detected at a very early stage, Honorable Speaker. So Garissa, we are working, and I think I'll also follow up what the Senator has raised. Once I leave here, just like the way I'll do for Mombasa and KNH and MTRH and all the other cancer centers, both public, private, and faith-based.
Honorable Senators, looking at the time, we are 50 minutes behind the schedule because there is time allocation for every question. I know we have 1 question left for the CS to respond to by Senator Minda Kibwana. So I have several requests here which I suggest, because they are actually on SHA, and we left that question. After the CS finishes the question by Senator Amina Kibwana, I'll give the senators, Mudama, my good friend, Senator